Hi, thank you for giving me an opportunity to highlight some of the great work of our Community Liaison team. My name is Dai Vu. I work for the Minnesota Department of Health. I work in the Center for Health Equity in the Culture, Faith, and Disability branch. Our Community Liaison team is comprised of 21 members pulled from all over the MDH enterprise for their unique skills and knowledge that they bring to this work. Our members intimately understand the many strengths and challenges of our communities most impacted by COVID. Our team is further broken down to 7 smaller teams to support our African American, our African born, our American Indian, our API, our Latinx, our LGBT, and our newly arrived immigrants. I've often thought of our teams as a muscle of the branch in that our members help to lift up many of the key activities in the COVID response, ranging from contact tracing, translation, voice-over for materials, assisting with contracts, assisting with community with testing events, and even fulfilling PPE requests. But it is with humble heart that our members engage, build, and strengthen relationships. Our team's work often centers on lifting up the voices of our communities through convening internal and external partners to address their needs. Please let me share a few examples of our team's successes. Back in May, our African-born team were able to engage Somali business owners, imams, and local public health to prevent the premature opening of the Carmel Mall during the state shutdown. Our API team have been hard at work engaging Hmong funeral directors and leaders in the development of funeral guidance. This was in a direct response to the concern of Hmong community to the larger gatherings that often occur during funeral processes. All of our teams have gained trust and credibility for MDH as part of the authentic engagement of communities across Minnesota. As one partner shared with our African American liaison, empowering community organizations and the people directly impacted is the best way to activate. Some of the challenges we face have not been able to fulfill the needs, and as a result, we've had to reach out to local public health and other partners, agencies, to connect our community partners to needs such as housing, food, and employment. And I also like to share a quote from Reverend Badminton Johnson. "The pandemic has been a source of fear and confusion. This is exacerbated in the African American community because of the well-earned mistrust with the life of Miss Henrietta Lacks and the Tuskegee experiment have shown. The decision of MDH to partner with our African American Church Network to deliver testing was vital to overcoming the skepticism, and the dedication and obvious commitment of MDH community liaison personnel allow the development of a team spirit that benefit the effort and bless our community." With that, I'd like to say thank you for highlighting some of this work.